My name's Lisa Hocking. I've been the Assistant Director for Infection Prevention and Control.
My name's Suzanne Jordan. I'm the Team Lead for Infection Control.
And I'm Annie Bence. I'm Infection Control Nurse.
So our primary role initially was to pull together guidance of how to manage COVID. It's a new infection. Nobody really knew what to do outside of what we knew for flu. We absolutely supported staff to get their fit test training done. We supported with policies and procedures and gave ward staff an awful lot of support in those early stages when they were dealing with something very, very new.
I would say for me, it was for the first wave how overwhelming it was for staff. It was new and the amount they had to learn and adapt. In the second wave, it was really how people continued to adapt and rose to the challenge extremely well.
I think that camaraderie that we saw within the trust during that period of time was overwhelming for us as a team, and to get that support and just to work together during that time was really, really important.
We continue to work really hard to keep everybody safe, and that's our staff, our patients and our visitors. We are all working with the virus that nobody can see, and it's constantly changing its cloak, and we're constantly trying to stay one step ahead to keep everybody safe.
Over the last 12 months, our biggest achievement has been able to keep up staff morale from the kind donations from the local community. In the future, the biggest thing we're looking forward to is being able to get the Brighter Futures events back off the ground and see our supporters face to face. The one message I'd like to share with our local community is just to say a massive thank you for all the support that you've given us over the last 12 months that has enabled us to support the trust and all the staff wellbeing.
I started off back in April or May with the Salute the NHS scheme, where generous donors were bringing food into the hospital, and lots of volunteers were responsible for packaging that up and making sure it got delivered to the wards. And then since December I've been on the vaccine clinic doing meet and greet with a lot of other volunteers, and that's what I'm currently doing at the moment. But I think the most proud has been being able to be part of the vaccination programme. I think this country's been through a very challenging time, probably as challenging, if not more challenging than many countries, but our vaccination programme is something that I'm really proud to be part of. I'm really looking forward to meeting my mum and dad again after the, hopefully when national lockdown 3 is eased. In terms of sharing my thoughts with the local community, I would just say that this hospital is a fantastic hospital, and the vaccination programme that we've got going here is amazing. We've given over 20,000, well over 20,000 vaccines now, and if anybody is very nervous about coming and getting their vaccine, we've had very, very nervous, anxious people through the doors, and it's fine. People get through it, and I would definitely encourage anybody who's having second thoughts not to be afraid and to come and get their vaccine when their time is due.